channel of Adamas International School and Adamas World School. So let's go ahead with today's session. I believe some of the parents have already are having their cup of tea, the evening tea. So let me introduce myself here. I am Ognai. I will be the moderator of today's webinar, which we have organized and bring forward with you with Manipal Hospitals, Salt Lake. Now, we all know that Mother's Day have passed. Last Sunday it has already passed, but we also believe that since mothers are the driving force of their homes, one day is not enough to give them the importance that they deserve. We believe that all the mothers should be given the due importance and the due significance every day throughout the year. And that is why we have selected one of the topics that would be beneficial for all the mothers who have joined with us here today. Now we know that, as I was just saying, that mothers are the driving force of their home. They are like a one woman army, basically. So with them when they are around us, everything just seems to fall into place. And there's a balance in life. There's a balance in the household, and everything is just in the happy place. But when she falls when she falls sick, or when she's not around, maybe due to some reason, we often see that life has become challenging for us. And hence it is extremely important that moms should be taking care of themselves in addition to their household, their children, their family members. It is of utmost importance that mothers are also taking care of themselves. However, it often happens, because everyone around us is having a busy life nowadays. So it often happens in this busy life that while taking care of the household, while taking care of the all the things that are happening across the house, and balancing their professional life and looking after the children, what homework has happened, this and that, often mothers don't find enough time to take care of themselves. Maybe wishing having wishes on Mother's Day, or having wishes on Women's Day makes us happy, but also if we can take care of ourselves, as mothers can take care of themselves, it will also make changes in their life, and it will drive their life towards even more happier days, we believe. So that is why together we thought, on behalf of both the schools, that why not let's take an hour time for all the mothers of our students here, and give them a chance to come in one platform and connect with us, connect with the experts from Manipal Hospital, Salt Lake, and get a chance to know some advices and some tips and some tricks through which they can make their days even happier. Now, as I was saying, that it is of utmost importance that mothers, in addition to the household, should take care of themselves, because without them, the households would just fall apart. Now, in case that in a situation where we are asking moms to take care of themselves, they should be practicing a healthier and active lifestyle, is what believed by doctors and field experts across the globe. Now, what is actually meant by an healthy and active lifestyle for a mother who is having children, who is having household to take care of? These details we would be knowing, the details of how to practice an active and healthy life. That would be our agenda of today's discussion, or will be the topic of today's discussion. And for that discussion, to take forward that discussion, in addition to the team of Adamas International and Adamas World School, we are having with us Dr. Joyita Chakraborty from Manipal Hospitals. And I believe that she has already joined us in our session today. So I won't be taking much of the time from her, and rather I would request her to continue with today's session, which is Happy Mothers, Inspiring Mothers, Leading an Active and Healthy Lifestyle. So, Dr. Chakraborty?
Yes, hello. Good afternoon.
Good afternoon. Good afternoon. Over to you, ma'am.
Okay, sorry to be a little late. Actually, my OPD was still continuing. But still, good afternoon to everybody and good afternoon to all the mothers out there. Today, actually, I'm here as a doctor to talk to you about some issues which you would encounter, or which you can say you can face as a mother, or to be precise, as a woman, as you go through. Now, I would talk for some time, and then I would rather request you all to interact with me and ask me questions so that actually I can know what are your specific problems or specific questions. I can only see myself. Can some of you just put on your video so that I can at least see to whom I am speaking? It would be fantastic if I could have I can talk to people rather than just to some names and the black and white screen there. Anyway, as you understand, now that you have become a mother, you have to give a lot of time for your children, for your dear and near ones. But at the same time, you happen to be the most important person in the family. Why do I say so? Because you are the backbone, or say you are the pillar of the family. And if you yourself keep fit and fine, and if you yourself are doing well, then only you can keep others happy and others healthy too. Now, few problems that are very common to women, I would be mainly covering those. For example, menstrual irregularities. Secondly, problems with anemia. Anemia happens to be a very common problem in our part of the country. And certain other problems like weakness in general, and these. So basically, let's start with menstrual irregularities. Now, often what happens is immediately after a delivery, you can have a little menstrual irregularities, and the young mothers who are yet lactating, they might find that their periods are not quite regular. This is due to the fact that they are lactating, and it is common that she might have no periods as long as the time she is breastfeeding. Now, after that, maybe say as your child grows up and as your child weans off, that is the time you should be having your periods normal. Now, what do I mean by having a normal periods? Normal periods means your cycles should be around, say, 28 to 35 days. Usually it can be 21 to 35 days also. Am I audible? Hello?
Yes, ma'am. Yes, ma'am. You're audible.
Yeah. So basically, if you are having a cycle which is less than 21 days, or maybe say more than 45 days, then that is abnormal. And that is when you should contact your doctor. Now, one of the common things that you might be hearing nowadays is something called polycystic ovary. Now, let me be very clear to you, polycystic ovary and having a cyst in the ovary, they are not the same things. Polycystic ovary is just a hormonal condition where there may be irregularities of the periods. Along with that, you might gain weight, and basically you might also have certain other problems like blackening of the skin, or maybe particularly of the neck and of the armpits, and the whole thing together is called the polycystic ovarian disease. Now, if you have this, one of the treatment is, of course, a lifestyle modification. That is, you should give a check on your weight so that you do not gain weight, and you should avoid junk food. You should be taking exercises quite regularly, and with that, you must be having treatment for that. By treatment, the most common treatment that we give to treat polycystic ovaries is actually a hormonal preparation, which are the oral contraceptive pills. Now, since I'm talking here about contraceptive pills, let me talk about contraception a little. As you may be a mother of 1 or 2 children, you may need to space your pregnancy, or it might be a time when you do not want pregnancy at all. Now, there are various methods now so that you do not get pregnant. Why we want to avoid unwanted pregnancy is that whenever you get pregnant in an unwanted way, either you go for, or you may choose to keep a pregnancy when you are actually physically and mentally not prepared. Now, both are not welcome. So what is needed is a proper contraception. So whenever you see a gynecologist, she will talk to you about a contraception, and we tend to give you a cafeteria of choice. What do we mean by that? There are various types of tea, there are injections now, and of course our age-old condom also stays. And if you plan not to get pregnant at all and you want to go for a permanent method, then you might choose permanent sterilization, what we call as the tubectomy or the ligation. Now, whatever method you choose, your doctor will be the best person to see whether you are suitable for it or not. And most of the times you are actually suitable for many of the methods, and you must choose one of them. What you cannot depend on is natural methods like, okay, fine, we didn't use contraception till date, so I will not get pregnant. The accidental pregnancy will not happen to me. No, that's a wrong idea, because we are not very sure about our ovulation date might be a problem also. So that way, basically, contraception is a must. And now coming back to what I was talking, the menstrual irregularities, one is your cycle, second is the amount of bleeding. See that your periods are, normally you are requiring say 3 to 4 pads in a day, and your periods are lasting say for 3 to 4 days, then that's normal. In case that you're tending to have a long duration, you are having too much of pain, then you must see your gynecologist, and usually we recommend sonography to find out whether you are having a problem which we call as a fibroid uterus or maybe a bulky uterus. The thing is, most of the treatment nowadays that we have are medical. To your doctor, it is basically we will go for an operation. Operation nowadays has become, you can say, the last resort. And even if we go for operation, it's almost gone are those days when we go for a big incision and operation like that. We prefer the keyhole surgery or what we call the laparoscopic surgery. But as I said, most of the treatment for heavy uterine bleeding or menorrhagia or dysmenorrhea, that is during your periods, is basically medical. Have too much of bleeding, or maybe if you have not taken adequate iron during your pregnancy or during your lactation, then you might be having iron deficiency. You will be stunned to hear that many of our women, irrespective of where they stay and from which socioeconomic background they are, they do suffer from anemia. One of the causes, of course, is increased menstrual blood loss. The other one is the type of diet with iron-rich food. And sometimes we have this habit of combining certain things. Suppose, say, one of the very favorite things is having doodh roti in our diet. Now, doodh roti, when we have, it prevents the absorption of iron as well as calcium. So we may not even be aware of the fact that even when we are having an iron-rich diet, the iron that we are having may not be absorbed well. So if you are feeling very really not getting that end-to-end energy to work, it might be due to iron deficiency anemia. And another important cause where you can have anemia, you might have lethargy, is if you are having an altered thyroid function. So if you have willingness to work, then you must get your hemoglobin and thyroid level checked. Another very important issue that I want to cover here for the wellness of mothers is, rather to be precise, women, is the cervical cancer. Now, in our country, cervical cancer happens to be the second commonest due to cancer, the first common cause being breast cancer. Now, cervical cancer is actually caused by a virus called HPV, human papilloma virus. Just the way that you are taking vaccines, or maybe you have already taken vaccine for corona, there is a vaccine against human papilloma virus. Now, this vaccine that is commonly available, it covers 4 types of strains of HPV, and it is called quadrivalent vaccine, and it's called the nonavalent vaccine, which covers 9 strains of cervical cancer virus. Okay, so you must get yourself vaccinated. Any girl or any woman between the age of 15 to 45 must get vaccinated against cervical cancer. And if you are within 26, you are a person who can get vaccinated with the nonavalent vaccine. So this is one way. And the other way where you can actually prevent cancer is to get yourself screened. What is screening? Screening means we have a look at your cervix, which is the lower part of the uterus, and we take a small smear from that. By smear, I mean we put in a small stick. It's not painful at all. And we just scrape out a little portion from there. It does not need any anesthesia. You just come to the OPD and we do it. And we see whether there are any cells which may be precancerous or cancerous or not. Now, pap smear and vaccine put together can be 100% protective against cervical cancer. So it is not only getting yourself vaccinated, you must be aware that your girl child and even the boy children, now they are also getting vaccinated with the Nona vaccines. The Nona vaccine, the nonavalent vaccine that has come up, Gardasil 9, that can even be given to the boys. So you might be wondering why to the boys? Because as I said, this is against the cervical cancer. They don't have a cervix, so why to the boys? Now, HPV infection not only causes cervical cancer, it can also cause cancer of the penis and also cause some viral disease, which is called wart, genital wart, where you get a small nodule-like thing in the cervix, in the vagina, or even in the penis. Now, if you are protecting your boys against with the HPV vaccine, he will be protected against warts and penile cancer. And since this HPV is actually transmitted sexually. So if we vaccinate our boys, so it will not be transmitted from a boy to a girl also. So this is a new vaccine which you should know and which you must be aware that you must take it, and you should be giving it to your child, your girl child, when she is after the age of 15. And for the boys, it can be given after the age of 15. However, it is in India, as of now, it is licensed up to the age of 26 if it is a nanovalent vaccine. Now, these are the common things and common ways by which you can stay fit. Another thing I would really emphasize is exercise. At least try to spend half an hour to 45 minutes every day, at least if not possible every day, 5 days a week, for some form of exercise. It can be walking, it can be dancing, it can be cycling. Even if you do not have time for anything and you cannot afford time to go out, do at least spot jogging. So you cannot say that I do not have time for exercise. You must have, because until and unless you do exercise, you cannot keep your weight in check. And exercise actually increases the blood circulation. Thereby, it also maintains the calcium level. And another topic I would like to include is white discharge. This is again very common problem in women. White discharge just before and after your periods, and say around the 14th to 16th day of your periods, that is in the mid-cycle, is quite normal, and we call that as physiological. But if the white discharge is accompanied by pain, or maybe if it is itching, or maybe if it has a very foul smell, then you must see your doctor. One of the commonest cause of having this type of white discharge is infection, and the infection can be a bacterial or a fungal infection, and we do give medicines against these. And there are certain hygienic rules that you must follow, that is keeping yourself clean. You must wash yourself thoroughly after passing urine, and after washing, you must also keep yourself dry. So if the area remains very moist, then what happens is you tend to get infection quite easily. Now, these are the common things that I have touched upon, and I would rather like you to question or you to interact with me in case you have specific doubts again regarding this women's health in general.
I think some of the parents would be asking some questions over here, and
Yes,
some of the common points that you have touched, that they are like really basic for every woman, not only mothers but every woman. But often we overlook them, and we do not, actually take care of ourselves in the right way. So I think it will act as a reminder for all the mothers who are present here today. And some of the parents have put up a question here in the chat box to us. Let me just open.
My chat box doesn't show any question. Anyway,
they have sent it to the school chat box actually.
Okay. You can ask these questions.
Yeah, sure. I'm just I'll just repeating the question. Just a moment. Okay. So one of the parents have asked that often in case of a busy life, she often skips breakfast, or she's just munching something that is handy. So how important is like having breakfast, and like what is the proper breakfast that one should be having, because her focus is majorly on what a kid would be eating. So how can how one can take care of oneself, and how important is having the breakfast for a mother?
Yes, absolutely. Breakfast is something which is extremely important because, as the name suggests, break fast. So if you are not eating properly after a night long time, if you remember, your stomach contains a lot of acid, and the acid keeps on secreting. And if you do not give food to the stomach, the acid will start acting on your mucous membrane, that is the covering on the stomach, and they will destroy the soft lining of the stomach. And that is when you would start having pain in the upper stomach, what we refer to as increased acidity, increased epigastric pain, and things like that. So it is very, very important to have a proper breakfast. Not only so, since it is the starting of the day, you should have adequate calories in order to give you enough energy to keep you going. And secondly, when you are taking a good amount of breakfast, that amount of calorie will actually be used up. If you are not having a proper breakfast, you will remain hungry, and your brain and your body will tend to absorb whatever you're eating later on to the full extent, because your brain will think, now this person is not going to give me food for maybe another 12 hours or 10 hours. So whenever I'm getting the food, let me absorb the full thing. So in doing that, what you end doing is gaining weight. So you must have a proper breakfast. And as the day goes on, your meals should become lighter. And it is always said that it is best to have your dinner a little early, maybe say by 7 or 8. And that should be the lightest meal. And the most full, and the breakfast must be adequate, not only in terms of calories, but also in the terms of minerals and vitamins. So try to include not only carbohydrate, but also vitamins and minerals like fruits, a little bit of nut. If you are in a too much hurry to cook a breakfast, you might half prepare it and keep it in the refrigerator, and be fast in cooking the rest of it in the morning. But you should never just leave your home without having a proper breakfast. No, breakfast is the most important meal of the day.
Exactly, ma'am. I think breakfast is such a meal that is important for everyone in the family. And of course, most importantly, the mothers should not miss it. Ishani Loshkor has also put up a question here. So she asks that what are the symptoms of thyroid, and mainly how can she identify this thing?
Okay, now thyroid disorders can be mainly of two types, the hyperthyroidism and hypothyroidism. We tend to commonly have the hypothyroidism, means that your thyroid gland here is not secreting enough of a hormone called thyroxine. Now, when that happens, you firstly tend to feel very lethargic and lack of energy to do any work. There is a lot of hair loss. The skin becomes dry, and you tend to put on weight. If you have these symptoms, you must get your thyroid checked. And when you're having hyperthyroidism, it's the other way around. Hair loss can be there in hyperthyroidism as well, but then you tend to become you tend to lose weight a lot. And sometimes it might be associated with big bulging eyes. There might be at times the thyroid gland swelling, and you might have something, tremor, fine tremor. When you extend your hand like this, it might have a little tremor or tremble a little. So these are the symptoms and signs of thyroid disorders. If you have these, then you must see a doctor and get your thyroid levels checked. I can see another question. Somebody has asked about mood swings. Is there a question on mood swings, right?
Yes, there's a question on mood swing.
What I presume a young mother or young ladies who are not yet nearby menopause. So I am answering mood swings in relation to the premenstrual syndrome. Sometimes what happens is, just before menstruation, your body has a very high level of progesterone. And as you have that, you tend to have a little bit of body swelling, little bit of pain in the breast, your breasts seem a little enlarged. Together with that, you might have quite like the mood swings, as you were saying. Means you can be a little irritable, and you don't really feel like working, and most importantly, you will always feel a little irritable is perhaps just the right word. Now, sometimes these may be quite physiological, and a little bit counseling helps. But if these become very severe, so much so that it's like having a normal day-to-day activity is becoming a problem, and your mood swings are creating problems for you, you are having depressions as well, then you must see a doctor. We usually give, again, this has a treatment with pills also, and there are certain vitamin B complex which reduces it. And if that is very severe, then we do refer them to psychiatrists to have a counseling session. If required, then medicine as well. But as you can understand, those are very rare cases. Mostly just before periods, what we have is the premenstrual mood swings, mostly the irritability, and those work well with the medicines that we give.
So I think there's another question, ma'am, that has come up. It's about okay. So Shivai's mom is asking about what should we do after having a cyst problem.
Now, cyst problem, to be precise, means a lot of things. Now, what do you actually mean by cyst problem? As one, I have said, polycystic ovary is not the same as an ovarian cyst. It is like Goria and Goriahat. There is a similarity in the word of Goria, but nothing similar as such. So basically, polycystic ovary, if you're talking about, it's a hormonal disorder and you have to take medicines. And polycystic ovary is like a disorder like hypertension and diabetes, which might need a lifelong treatment. By lifelong, I do not really mean for the whole life. I mean for a long period. And we tend to keep it checked, your hormonal problems checked with the medicines. And as soon as you become quite normal, we tend to put off the medicine. Now, if you are talking about real ovarian cyst as such and not polycystic ovary, ovarian cyst means suppose you have your ovary like this, something has grown on top of it. That is what we call ovarian cyst. Ovarian cysts are best diagnosed with an ultrasonography. And if the cyst is very big enough, and if it is an operation which is required, we usually go for a laparoscopic operation, that is the keyhole surgery. And many of the cysts do not recur, except a cyst called the endometriotic cyst, which occurs when there is accumulation of menstrual blood. This, of course, has a tendency to recur. Since they have a recurrence after the surgery also, we give medicines so that they don't recur.
And I think it's a common problem, growing problem among women nowadays. So having a clear conception and word from the expert also helps us to understand and how to control it or keep it under check. So Shoma Chakraborty here has asked about vaginal secretion. So she asks what to do if even after taking proper medication, the problem still continues. And like she has taken, she also mentions that she has taken consultation from doctor, but the problem has continued. So what to do about this?
Okay, so what I understand reading your problem is you are having a fungal infection which is quite resistant. Okay, now resistant fungal infection means that there either there is resistance or there is recurrence, means your fungal infection is coming back and back every time. There are few things. Number one is the hygiene that I talked about. There are certain hygienic things, keeping yourself clean, like particularly say before and after having intercourse, you must wash yourself thoroughly. You must keep yourself dry. And this is the hygienic portion. In these women, we ask them not to use tampons, because the tampons can further aggravate the problem if it is already existing. And the other portion now comes the medicine. One of the common causes for recurrence for fungal infection is diabetes. You must be very sure, and you must get your blood checked to see whether you are having fasting and PP blood sugar and HbA1c to rule out diabetes. And it must be treated, means both the partners must be treated. Your husband should be given the medicine as well, because these fungal infections and recurrent and resistant fungal infections often subsides when we do treat the partner as well, because the infection often stays with the partner. And if we are treating only the woman, the infection comes back from the partner to the woman again and again. And there are specific medicines which are there for fungal infections, especially the resistant infection. Your doctor must be knowing those. You have to understand that it is not the simple medicines that should be taken. There are specific medicines for recurrent and resistant fungal infection. Having said that, there is also another thing that you must take, that is called what we call the good bacteria. In our system, in our gut, in our vagina, we have good bacteria which keeps away the bad fungus. So if your vaginal like the good bacteria, they become deficient. Sometimes they can become deficient if you have perhaps taken antibiotics for a long time. Then there are medicines to replace them as well. And another thing, if there's still a recurrence, you must go for a pap smear. As I was saying, the cervical discharge is taken and it is sent for testing to see what type of infection, or are there any other problems there as well. You must get a pap smear done. And these patients who tend to have recurrent vaginal infection, they must take vaccine against cervical cancer.
I think these are like questions of concerns and topics of concern that we often are ignorant about, but are of utmost importance for our health. So, ma'am, another mom, she has asked that she's gaining weight because of cyst. So, how to control it? I think this question also relates to how can, in general, we have a healthy lifestyle.
Of course, like as I can go on talking about healthy lifestyle, which really means cutting down on your carbs. I don't mean a zero carb diet. I do not mean a keto diet. What I mean is a balanced diet. And what we definitely lack is exercise. We tend to sit and work. We do not take the stairs. We tend to we have become quite lazy and dependent on different gadgets. So we tend to gain weight so much because we do not exercise. And as I said, polycystic ovary is a condition, is a hormonal condition where you tend to gain weight. And if you are having if you are an obese person, then your polycystic ovary gets worsened. So it's like which came first, the hen or the egg? Means your polycystic ovary worsens if you are obese, and if you are obese, then you tend to get this polycystic ovary. Means it does not become curable very easily. So the proper diet and adequate exercise, these two, I must say, if you go back today with two messages, or to be precise, one message, that must be to give a check on your diet. Sometimes nowadays I see so young mothers, and not only mothers, like say 19, 20 years girls, they are weighing 90 kgs, almost 100 kgs, and they're just not like, I cannot overemphasize, but once you talk to them, they might start feeling, okay, fine, you're body shaming me and things like that. It is not a question of body shaming. It is trying to point out that once you gain too much of weight, then what happens, your body becomes prone to many diseases like hypertension, diabetes, polycystic ovary, arthritis, like your joints, they start aching. So One message that you should remember from today's discussion is not to gain weight, or if you have gained weight, take very, very serious measures. If required, consult a good dietitian and cut down on your calories, cut down and do sufficient exercise so that you can really keep a check on your weight.
Absolutely, absolutely, ma'am. And we have another question from Snigdha Bakchi. She asks about how to reduce migraine or effects of migraine in women. Possibly she's suffering from vomiting, weakness, dizziness, and reluctance to work and fatigue. So how can, in general, she avoid all this and not let migraine bother her in her daily life?
Okay, Mrs. Bakshi, I am not a neurologist, but what I understand from your question, your migraine is really, really bothering you a lot. You must see a good neurologist and be under treatment. There are certain things that we say. Number one is avoiding certain food which can start off the migraine. Number two, prolonged exposure to light, or maybe say the laptop and things like that, which has a very concentrated radiation to your eyes. Those sort of things must be avoided. And as I said, certain food must be avoided, stress must be avoided, sleeplessness must be avoided. And if a woman has migraine, we never give them oral pills, because oral pills are otherwise safe in most of the women. Most of the cases we can give, but we do not give in women who are having migraine. And you must see a doctor. If you are already consulting, then please get back to him or her, because what I understand, you are really, really suffering. And make sure it is actually migraine, it is not anything else. The things that you have written, reluctance to work, fatigue, can also be due to anemia and due to thyroid disorders as well. And please get your prolactin checked as well, because increased level of prolactin, that is again a hormone that can also cause similar things. And your power means you must get your refractive error checked, whether you have that as well. Sometimes we tend to blame one single thing. If we know that, yes, we are having perhaps migraine, we tend to give everything to migraine. It might be other things as well. So please see a doctor, particularly a good neurologist, so that he or she can come to your help.
Absolutely, ma'am. So, ma'am, we have another question from one of the moms of our student, where she's facing certain irregularities in her menstrual cycle that lasts for 4 days, and then from again 5th to the 8th day, she's facing problems again, having symptoms as a normal cycle. So, how can she undo, or like how can is it something that is both bothering, or is it normal?
No, it's definitely not normal. What I understand, that she is having a normal 4-day periods. Then again, from the 5th day, she's having quite heavy periods. So that is absolutely not normal. You must go for certain tests like the sonography and blood test to particularly the hormones like the thyroid. And most probably from your ultrasonography, we would come to know what you are having. It might be that the uterus, what we call the lining of the uterus, that is called the endometrium, that might have been thick, or you might be having a little small tumor, what we call the fibroid. Sometimes without even fibroid, the uterus can itself become very bulky and big. But as I said, most of these conditions are treatable with medicine. Do not think that if I go to a gynecologist, he or she will immediately go for an operation. No, not at all. There are lots of good medicine that have come up. There are certain things called a Mirena. Mirena means a small T-shaped soft thing made of silicone, which we put in the uterus, and that goes on releasing a medicine. So that way there are medical treatments, various medical treatments, which can be given, and you need to see a doctor immediately, because the way you are bleeding, you will soon have anemia. So please see a doctor immediately. Do not neglect it.
Absolutely, ma'am. Ma'am, one question that I would actually like to ask from my side to you What happens in case of, particularly in case of the Indian scenario, is that as women, not only mothers but as women, what happen, only when we are facing some problem, some biological problem, we tend to visit the gynecologist. But actually, how frequently, or I mean, we should be in touch with our gynecologist as women?
Excellent question. This is what we are stressing now, that is preventive medicine. As you all understand, prevention is much better than cure. And like certain things must be done once every month. You must check yourself, go for a self breast examination. If you want, you can come over, we can teach you, or you can go to the YouTube and see a proper self breast examination. But then, to give it to you in short, after your periods are over, stand in front of a mirror without your clothes on, and first look at the mirror and see whether you can see any definite changes in your breast or not. Then with your one hand behind your head, you press it hard so that your muscles here become strong. And with the palm of the other hand, you must palpate with the right hand, you must palpate your left breast, and with your left hand, you must palpate your right breast, and try to see whether you can feel any lump or nodule or anything. If you do find, don't panic. Most of the cases, they are benign, and please see your doctor. And end it by squeezing your nipples just a little to see whether there is any discharge or not. So that is one prevention, one thing which you can do regularly, because like breast cancer is very, very common in our country. It happens to be the most common cancer among women in our country, and it is detected at a very early stage. Its longevity is fantastic. So please be careful about it, especially if you have a family history. At least go for the self breast examination, and if you are in doubt, contact your doctor. That is one. Second thing is getting a pap smear done. As I said, for women who are before menopause, they must get pap smear done once in every 3 years, if not at least once in every 5 years. And the other one is taking a cervical cancer vaccine so that you can protect yourself. Other than this, there are certain tests which should be taken every year if possible. At least you should see a doctor every year who will check your weight, your blood pressure, whether you're having anemia or not, and a complete general checkup as such. Means seeing your neck, your breast, the abdomen. And there are certain tests. Most of the hospitals, like our hospital, has a well woman like test sort of things, where we include hemoglobin, then thyroid test, liver function test. It all comes in a package. That sort of test, you must get it done at least once in every year. And if you find there are any problem, do get in touch with a doctor.
I think this is something that we should be practicing actually in our daily life. So, ma'am, we have the last two questions over here. One of the parents have asked that what kind of supplements one should be taking after reaching 40, and another mother has asked that she's 34 years old and she is suffering with arthritis in both the knees. So there's a calcium D deficiency. So what are the problems that she will be facing in her future days? So these are the two last questions I believe that we have from our parents' side. If you can just kind of...
Okay, if I can combine both the questions. Basically, as I said, few things are extremely important minerals and vitamins in our body: iron, calcium, and vitamin D. Now, unfortunately, we are very deficient in vitamin D. By we mean Indians in general, and the northeastern part here. Though the Tropic of Cancer passes over our state, and we think that we are quite exposed to the sun, but we are not actually. We do not spend much time out in the sun. Even if we are applying a lot of sunscreen or wearing full sleeve dresses. So vitamin D deficiency is quite common in our this part of the country, and you must get your vitamin D checked in general to see whether you're deficient, because vitamin D is essential not only for the bones, it has a huge role in almost all metabolic and all the reactions that go on inside your body, starting from even building up hemoglobin. There also vitamin D has a part. So that is extremely important. So check your vitamin D level. If it is less, then do take vitamin D. And as such, you need not take routine supplements as such, taking calcium or vitamin D routinely if you are deficient. But your diet must be quite balanced so that you are taking adequate amount of minerals and vitamins. But if you are a person who tends to avoid, or maybe if you're not taking a balanced diet, then you must take a supplement which is rich in calcium, iron, and vitamin D. Not only after 40, but as such in general, especially if you are having too much of, if you're a person who has too much of acidity, if you're a person who has too much of diarrhea and digestion issues, then your absorption rate is less. In these cases, you might need a supplement. And there are certain disorders like the thyroid disorders, where in general the minerals are absorbed less. So you need to take supplements in these cases. But otherwise, if you are a person, if you are a woman who is otherwise active, taking a balanced diet, and your vitamin levels and iron they are fine, you need not take a supplement as such. Just go on taking your balanced diet. And just, if I may touch here, and I suddenly remembered, nowadays I am seeing a lot of women smoking. Now, I'm not going into a very feminist or not those issues, but smoking in general is bad for health, be it a man, be it a woman, whatever. So if you are a person who smokes, please give it up. That is one issue. And talking specifically about osteoarthritis, like osteoarthritis means it is a degenerative change, means all our knees are also aging with us. For some, this aging process, particularly for the knees, might have started a little early. So it is not only taking calcium and vitamin D, you might have to take like painkillers at time, but be very careful whenever you're taking a painkiller. It must be a prescribed one, and it must be taken after food, and preferably with an antacid. Now, in future days, so that you do keep healthy, consult your doctor so that he or she teaches you certain exercises so that your knees are mobile, means it does not become very stiff. And if you are on the obese side, please do lose weight so that your knees do not start crying of and telling that I'm trying to bear a lot of weight, because that would actually enhance the degenerative changes. So best way is to lead a balanced life in general. Exercise, balanced food, not too much of partying and smoking, of course, no. And be a disciplined person. As such, there is the best way to live a healthy life is perhaps to be disciplined. Actually, at a very young stage, my father taught me what is the meaning of discipline. It means sacrificing small things to gain bigger things in life. So if you really want to remain healthy, happy, and avoid doctors as such, then the best way would be having a little discipline in your life.
Thank you so much, Dr. Chakraborty, for sharing all these insights. And thank you for connecting with the moms from Adamus International and Adamus World School on behalf of Manipal Hospital. And I think all the moms here who are present with us, are connected with us. They have taken some of the, like real important insights through which they would be leading a healthier life. They will be the happier moms. They will be the inspiring moms, because happy moms, I believe happy moms inspires everyone around them. So thank you so much for your time, everyone. Dr. Chakraborty and all the mothers who had connected with us. Thank you so much.
And thank you
And
so much from my side for being so interactive. Your questions
absolutely,
would make me talk to you more.
absolutely, ma'am. Absolutely. Thank you so much. Have a happy weekend, everyone. Thank you and good night.
Thank you. Bye-bye. Bye-bye.
Bye.